Welcome to today's video. If you're preparing for the NCLEX, you're in the right place. In this video, we'll walk you through 25 practice questions covering a wide range of topics, including medical surgical nursing, pharmacology, pediatrics, maternity care, and mental health. These questions are designed to mimic the style and difficulty of the actual NCLEX exam, helping you build confidence and sharpen your critical thinking skills. Each question comes with detailed explanations, so you'll not only know the correct answer, but also understand the reasoning behind it. Whether you're studying for the first time or brushing up on your knowledge, this practice test is a great way to assess your readiness and identify areas where you might need more focus. So grab a notebook, stay focused, and let's dive into these 25 NCLEX-style questions together. Don't forget to pause the video if you need more time to think, and feel free to leave a comment if you have any questions. Let's get started. Question 1. In a unit where a nurse works, there is a conflict between two other nurses that is affecting team morale and productivity. What is the most appropriate action for the nurse to take? A. Ignore the conflict and focus on their own tasks. B. Report the conflict to the supervisor right away. C. Address the issue by expressing concern and offering to mediate. D. Avoid interacting with the two nurses to prevent further problems. Answer. C. Address the issue by expressing concern and offering to mediate. Explanation. The nurse should take the initiative to resolve the conflict by bringing the two nurses together, expressing concern about how the conflict is affecting the team, and offering to help mediate. If the conflict continues, the nurse can then escalate the issue to the supervisor. Ignoring the conflict or avoiding interaction is not effective and could make the situation worse. Question 2. A nurse manager learns that the staff feels the weekend scheduling system is unfair. What should the nurse manager do to address this issue? A. Create a new schedule without consulting the staff. B. Ignore the complaints and enforce the current schedule. C. Involve the staff in discussing alternative scheduling options. D. Assign weekend shifts randomly to avoid bias. Answer. C. Involve the staff in discussing alternative scheduling options. Explanation. Involving the staff in the decision-making process fosters a sense of fairness and respect. Even if not everyone agrees with the final decision, staff satisfaction increases when they feel their input is valued. The nurse manager should facilitate discussions to develop a fair and acceptable solution. Question 3. A new nurse is assigned to change a patient's tracheostomy tube, but has never performed this procedure before. What is the best course of action for the nurse? A. Attempt the procedure to gain experience. B. Refuse to perform the task and leave it to someone else. C. Ask the team leader for assistance. D. Watch a tutorial video and then perform the procedure. Answer. C. Ask the team leader for assistance. Explanation. The new nurse should inform the team leader about their lack of experience and request assistance. The team leader can then decide whether to train the nurse or assign the task to someone more experienced. Patient safety is the top priority, and performing a procedure without proper training could lead to harm. Question 4. While reviewing a patient's orders, the nurse notices that informed consent is required for an upcoming surgery. The nurse was not present when the doctor explained the procedure. What should the nurse ask the patient before obtaining consent? A. Sign this form so we can proceed with the surgery. B. What did the doctor tell you about the surgery? C. The doctor explained everything, so you just need to sign here. D. Do you have any questions about the surgery? Answer. B. What did the doctor tell you about the surgery? Explanation. Since the nurse was not present during the doctor's explanation, they should assess the patient's understanding of the procedure. This allows the nurse to clarify any misunderstandings, answer questions, or contact the doctor for further information. Ensuring the patient fully understands the procedure is essential before obtaining consent. Question 5. A patient with a history of chronic liver cirrhosis was admitted 2 days ago for an infection. During the initial assessment, the nurse observes that the patient seems lethargic and has a sweet, musty odor on their breath. What should the nurse assess next? A. Check the patient's vital signs. B. Look for flapping hand tremors. Asterixis. C. Assess for signs of jaundice. D. Monitor the patient's urine output. Answer. B. Look for flapping hand tremors. Asterixis. Explanation. The patient's symptoms, lethargy, and sweet, musty breath suggest hepatic encephalopathy, a complication of liver disease. Asterixis, flapping hand tremors, is a classic sign of this condition. The nurse should assess for this to confirm the diagnosis and initiate appropriate interventions. Question 6. Which of the following individuals is not allowed to sign their own consent for a surgical procedure? A. A 21-year-old adult. B. A court-appointed guardian. C. A patient with a durable power of attorney for healthcare. D. An unemancipated minor. Answer. D. An unemancipated minor. Explanation. An unemancipated minor cannot provide consent for medical procedures. Their parent or guardian must do so. A 21-year-old adult, a court-appointed guardian, and a patient with a durable power of attorney for healthcare can all provide consent. Question 7. A patient is scheduled for an inguinal hernia repair. What must be included in the informed consent for this procedure? A. The risks and benefits of the procedure. B. The surgeon's qualifications. C. The cost of the procedure. D. The nurse's name and credentials. Answer. A. The risks and benefits of the procedure. Explanation. Informed consent must include an explanation of the diagnosis, the nature and reason for the procedure, risks and benefits, alternative options, and the risks and benefits of not having the procedure. The surgeon's qualifications, cost, and nurse's credentials are not required elements of informed consent. Question 8. A healthcare provider is planning care for 4 patients. Which patient is at the highest risk for anemia and requires immediate intervention? A. A patient with renal failure on hemodialysis. B. A patient on a vegan diet. C. A postpartum patient with a Jackson-Pratt drain. D. A patient with a history of asthma. Answer. A. A patient with renal failure on hemodialysis. Explanation. Patients with renal failure are at high risk for anemia due to decreased production of erythropoietin, a hormone that stimulates red blood cell production. Hemodialysis can also contribute to blood loss, further increasing the risk of anemia. Question 9. A patient with anemia is admitted to the medical unit. The healthcare provider orders diagnostic tests to determine if the cause is gastrointestinal bleeding. Which task can the nurse delegate to an unlicensed assistive personnel? UAP. A. Administering a bowel prep. B. Collecting and testing a stool sample for occult blood. C. Witnessing informed consent. D. Assessing the patient for allergies. Answer. B. Collecting and testing a stool sample for occult blood. Explanation. UAPs can perform tasks that do not require nursing judgment, such as collecting and testing stool samples. Administering medications, witnessing consent, and assessing allergies are responsibilities that require a licensed nurse. Question 10. In a pediatric unit, the healthcare provider has several patients to assess. Which patient should be prioritized first? A. A 17-year-old with a left pleural effusion complaining of chest pain rated 9 out of 10. B. A 10-year-old with asthma and mild wheezing. C. A 5-year-old with bronchitis and a cough. D. A 12-year-old with a fever of 101 degrees Fahrenheit. Answer. A. A 17-year-old with a left pleural effusion complaining of chest pain rated 9 out of 10 patient with pleural effusion and severe chest pain is the priority because they are experiencing an actual problem that requires immediate assessment and intervention. The other patients have stable conditions or less urgent symptoms. Question 11. What right does Title VI of the Civil Rights Act of 1964 guarantee in healthcare? A. The right to refuse medical treatment based on personal beliefs. B. The right to equal access to healthcare regardless of race or religion. C. The right to free healthcare services. D. The right to sue healthcare providers for malpractice. Answer. B. The right to equal access to healthcare regardless of race or religion. Explanation. Title VI prohibits discrimination based on race, color, or national origin in any program or activity that receives federal funding. This ensures equal access to healthcare services for all individuals. Question 12. After receiving the shift report, a nurse reviews their assignments. Which patient should the nurse assess first? Choices. A. A patient with a fever of 102 degrees Fahrenheit. B. A patient who needs discharge instructions. A patient with a fresh arm cast complaining of numb fingers. D. A patient with a history of diabetes. Answer. C. A patient with a fresh arm cast complaining of numb fingers. Explanation. Numbness in the fingers after a cast application suggests compartment syndrome, a medical emergency that can lead to permanent nerve and muscle damage if not treated promptly. This patient requires immediate assessment and intervention. Question 13. The nurse is assigning tasks for the day shift in a medical surgical unit. Which patient is appropriate to assign to a licensed practical nurse, LPN? A. A new admission from the emergency department with syncope. B. A patient with peripheral vascular disease and a leg ulcer. C. A patient requiring preoperative teaching. D. A non-compliant patient with diabetes. Answer. B. A patient with peripheral vascular disease and a leg ulcer. Explanation. LPNs can care for patients with stable chronic conditions like peripheral vascular disease and leg ulcers. New admissions, preoperative teaching, and non-compliant patients require the expertise of an RN. Question 14. Several patients arrive at the diabetic clinic for appointments. Which patient should the nurse see first? A type 2 diabetic patient with a headache and fruity breath odor. B. A type 1 diabetic patient with a blood sugar of 60 milligrams per deciliter. C. A patient with a blood sugar of 250 milligrams per deciliter. D. A patient with a history of hypertension. Answer. A. A type 2 diabetic patient with a headache and fruity breath odor. Explanation. A headache and fruity breath odor are signs of diabetic ketoacidosis, DKA, a life-threatening condition that requires immediate assessment and intervention. The other patients have less urgent needs. Question 15. A nurse is considering a role as a case manager. Which of the following is not a responsibility of a case manager? A. Writing orders for the insurance company. B. Coordinating care for patients. C. Educating patients about their conditions. D. Referring patients to community resources. A. Writing orders for the insurance company. Explanation. Case managers coordinate care, educate patients, and refer them to resources, but they do not write medical orders. Writing orders is the responsibility of healthcare providers. Question 16. A nurse notices a discrepancy in the medication records of a patient prescribed high doses of narcotics. What should the nurse do first? A. Document the discrepancy in the patient's chart. B. Notify the pharmacy about the issue. C. Notify the unit's nursing supervisor. D. Ignore the discrepancy if the patient is not in pain. Answer. C. Notify the unit's nursing supervisor. Explanation. Discrepancies in narcotic records must be addressed immediately. The nurse should notify the nursing supervisor, who has oversight of the unit and can investigate the issue further. Question 17. When caring for a patient with deep vein thrombosis, DVT, which finding requires immediate intervention? A. Swelling in the affected leg. B. Respiratory rate of 34 breaths per minute. C. Mild pain in the calf. D. Redness over the affected area. Answer. B. Respiratory rate of 34 breaths per minute. Explanation. A rapid respiratory rate may indicate a pulmonary embolism, PE, a life-threatening complication of DVT. This requires immediate intervention to prevent further complications. Question 18. A new mother who delivered a healthy baby one day ago tells the nurse she is considering giving the baby up for adoption. How should the nurse respond? A. You should keep the baby. It's the best thing for you. B. Can you tell me a little about the options you have right now? C. I'll call social services to handle this. D. You need to discuss this with your family first. Answer. B. Can you tell me a little about the options you have right now? Explanation. The nurse should use open-ended questions to explore the patient's feelings and options without imposing personal values. This helps the patient make an informed decision. Question 19. A nurse in the neonatal ICU accidentally administers an adult dose of digoxin to a 3-pound infant, causing permanent damage. What legal charge could the nurse face? A. Negligence. B. Malpractice. C. Assault. D. Battery. Answer. B. Malpractice. Explanation. Malpractice occurs when a healthcare professional performs an act or fails to act that results in harm to a patient. Administering an incorrect dose of medication, especially one that causes permanent harm, constitutes malpractice. Question 20. What is the term for an intentional attempt or threat to touch someone without their consent? A. Negligence. B. Assault. C. Battery. D. Defamation. Answer. B. Assault. Explanation. Assault is the intentional act of causing someone to fear harm or injury, even if no physical contact occurs. Battery, on the other hand, involves actual physical contact without consent. Question 21. A patient with a history of asthma undergoes a minor procedure. After the procedure, the patient complains of chest tightness, and their peak flow drops significantly. What is the nurse's priority action? A. Notify the healthcare provider. B. Administer a PRN dose of albuterol. C. Provide oxygen therapy. D. Reassess the patient in 15 minutes. Answer. B. Administer a PRN dose of albuterol. Explanation. A peak flow reading less than 50% of the patient's baseline indicates a medical alert. The nurse should administer a short-acting beta agonist, albuterol, immediately to relieve bronchospasm and improve airflow. Question 22. A confused patient is left unattended with the bed rails down and the bed in a high position. If the patient falls and breaks a hip, what legal charge could the nurse face? Choices. A. Assault. Battery. C. Negligence. D. Defamation. Answer. C. Negligence. Explanation. Negligence is the failure to provide reasonable care to prevent injury or harm. Leaving a confused patient unattended with the bed in a high position and side rails down is a breach of duty that could result in harm. Question 23. A case manager is overseeing a patient who cannot read or understand medical terminology. Which role of the case manager is most important in this situation? Choices. A. Screening. B. Translator. Caregiver. Director. Coordinator. Answer. B. Translator. Explanation. The case manager must communicate effectively with the patient, translating medical terms and procedures into language the patient can understand. This ensures the patient is informed and can participate in their care. Question 24. A healthcare provider orders soft wrist restraints for a patient. Which task can the nurse delegate to a certified nursing assistant, CNA? A. Assessing the patient's mental status. B. Assisting with bathing, feeding, and toileting. C. Documenting the patient's status every hour. D. Educating the patient about the need for restraints. Answer. B. Assisting with bathing, feeding, and toileting. Explanation. CNAs can assist with activities of daily living, ADLs, like bathing, feeding, and toileting. Assessing, documenting, and educating are responsibilities of the licensed nurse. Question 25. A patient with aspiration pneumonia started IV antibiotics 8 hours ago. The nurse notices a foul odor in the room. Which statement by the patient indicates a complication? A. I'm coughing up thick brown sputum. B. I feel short of breath. C. My chest hurts when I cough. D. I have a fever. Answer. A. I'm coughing up thick brown sputum. Explanation. Thick brown or purulent sputum suggests a lung abscess, a complication of aspiration pneumonia. This requires immediate intervention to prevent further complications. Great job making it through all 25 questions. We hope this practice test helped you feel more confident and prepared for the NCLEX. Remember, the key to success is consistent practice and understanding the reasoning behind each answer. If you found this video helpful, don't forget to give it a thumbs up, subscribe to our channel for more NCLEX prep content, and hit the notification bell so you never miss an update. If you have any questions or want us to cover specific topics in future videos, leave a comment below. We'd love to hear from you. Keep studying, stay focused, and remember, you've got this. Good luck on your NCLEX journey, and we'll see you in the next video. Until then, happy studying!